Hilziger. I'm the medical assistant program director at Alpena Community College. If you've ever gone into a doctor's office and thought that that was someplace that would be interesting to work, then you're going to want to give me a call and let's talk about what you have to do to become a medical assistant. Because most of the people that you see in the doctor's office that are working there for the doctor are medical assistants nowadays. We have a 2-year associate degree program. It's an associate in applied science, and we have it broken up into 2 years of training. The first year, you're going to work on what we call the administrative courses. And with that, you're going to work on learning what you need to do to work in the front of the medical office. And you're going to be focusing on things like medical terminology, where you learn the language of the medical field. You're also going to be learning how to use the software that you use in the medical office, actually both front and back office, that you would learn electronic health record and the practice management software. And you're going to learn things about insurance billing and some about the coding for diagnosis and for procedure. And you're just going to learn how to work with patients of all kinds, maybe patients that have problems seeing or hearing, or how to work with patients who aren't feeling well. And then you're going to learn to work with practice finances. And after you go through that first year and you're learning what you need to work in the front office, then we'll put you out in the summer for a practicum, where you're going to take everything that we've taught you and everything you've read in the books, and you're going to actually apply that in the real world, hands-on. You're going to be working with the people that actually do this for a living in the doctor's office, and they're going to help you apply that. But because we are an accredited program, we are required always to make sure that there are certain things that you have been taught by us and that you have learned and that you have a C or better, to show proficiency or competency in those areas. And if you show that level of competency, then we can keep you progressing through the program. So then we bring you back for that second year, and that's where you get what we call the clinical level training, or the back office skills. So you'd be working right with the doctor for that. Those skills would be what you do, working right with the doctor. So at that point, you'd be learning things like how to give injections. You'd be learning all the different positions that the doctor may need the patient in for different types of examinations. You'd be learning how to set the patient up for EKG, actually putting the electrodes on the patient's body and running the EKG machine to get that strip to take to the doctor. You'd be learning how to do all kinds of what we call CLIA wave testing. So things like strep throat, mono, pregnancy, drug testing, flu, now COVID-19. We can test for blood sugar, the 3-month, the A1C. We can test to see someone's hemoglobin and hematocrit, cholesterol. There are a large number of things that we can test for now in the doctor's office, and medical assistants are taught how to do all that. We can do pulmonary function testing. Pretty much anything in a doctor's office that can be done outside of what's the doctor's responsibility is something that a medical assistant does. So we assist with the exams, minor office surgery. I found it to be a fantastic experience because I never got bored. I always had something new and exciting that I could do. I could work up front one day and the back the next, or if I wanted to have a job where I only worked back office, then that's the type of job that you would look for when you were out hunting for a job, or you could work just up front if you wanted to. I had a job for a while where I worked for a physician where I did everything for that physician from front office through back. And so you can pick your specialty. If you wanted to work pediatrics or geriatrics, you wanted to work orthopedics, and you just look around for that type of job and apply. Medical assisting is one of the fastest growing medical career fields that there are out there. there's a high demand in this area. So if you didn't want to move, you don't have to. Our students usually have a job lined up before they've ever even finished the program. So if you're at all interested in working in the doctor's office, um, take a look on our website. There's another video out there that tells you some more about medical assisting, and I would be very happy to talk to you. So contact me and we'll talk.